Dr. Atlich, welcome back to Bija, Clark
you.
Hospital. Greetings from Punjab.
Yeah.
We'll be talking about reflux and bariatric surgery, especially MGP. We see every day majority of the obese patients who are fat, they have some component of gastroesophageal reflux disease.
Yes.
They have maybe burning hair or some reflux, or they are taking the antacid pills.
But wait a
And-
second.
Yes, sir.
You know, in America,
Uh-huh.
we have the drug, PPIs,
Yes.
right?
Mhm.
Okay. What percent of Americans are taking PPIs?
I don't know exactly. but-
One out of every four.
1 out of 4.
In other words,
25%.
the whole earth is now taking PPIs.
Yeah, it's in every house. So when it comes to doing MGB, now we have seen for more than 2 decades, and reports are coming from different corners of the world. Earlier, there was some confusion, but now things are settling and becoming very clear that MGB is actually behaving as an anti-reflux procedure. Do you agree with this? What do you want to say about reflux and mini gastric bypass?
Well, so the way you ask that question, it brings up what's called the MGB paradox. Okay, what we know is that there are some surgeons who do the MGB and has terrible reflux. Okay, so I'll just give one example. Australia did several hospitals. They pooled all of their what they called their single anastomosis bypasses. So they're not doing the MGB the way you and I do it. They made up some version of it, and they said 10% of their SAGBs had to have reoperation within the first few years because they had crippling bile reflux.
Yeah.
1 out of every 10. Okay?
That's too high in incidence, yeah.
Could you imagine if you were having that?
No, you cannot.
You would have
continue with
thousands
practice
of
like that.
people
Yeah.
having reflux. Well, so this is what I call the MGB paradox. So 2 people claiming to do a 1 anastomosis type bypass, and one has terrible outcomes, like Mario Musella. He's published a number of hospitals in Italy. Very rare. Very
Yeah,
rare.
he's our friend from Italy.
Yeah.
He has published more than 2,000 cases.
Yeah,
And look
very
at his
rare.
reflux, very rare.
And then you have like the Y omega,
Coming from France.
the Y omega people. They have terrible outcomes,
Yeah.
right? Okay, so when you look at this, you say, well, why is this? Well, one is that all the MGB that are doing well could be fibbing because it's really terrible and they're just not talking about it. Or how can there be such difference? Well, the simplest thing in the world is to just say they're doing different operations.
Yeah.
Okay? In other words, the Y omega trial and the people in Australia, they did nothing to talk to anybody who's an expert in MGB. They just started doing it. They figure, well, we're good surgeons, we know what to do. And I've seen their videos, okay?
Yeah.
Their videos say that when we make the connection between the stomach and the bowel, we twist it, we kink it, we
Yeah.
stitch it tight, it's
Yeah.
narrow, it doesn't have blood supply.
Yeah.
So first of all there's no such thing as MGB if you're not doing actually an MGB. So-
Exactly. Because for our surgical friends who are watching us, MGB is actually a T connection. And on one hand, you have the loop where bile is coming from one side and going down, and the food is falling at the same point. So this T junction has to be designed very carefully, like Dr. Rutledge is telling us. If there is any kind of tightness, twist, especially at the outlet.
Of course, because it's trying to get out. If you can't
then
get
the bile
out,
is going to come up.
what do you think will happen? I mean, this is so simple.
Yeah.
And the other thing is, we see people kill the blood supply. Well, imagine what it's like when you put food on top of a dead tissue that has no blood. It gets angry and upset, it goes backwards. So those are important, that's technical issues. But the other thing is that even with a good MGB, we know patients can do bad things.
Yeah.
Now, what I mean by that is, let's suppose that you eat a whole bunch of food fast. Okay, well,
Yeah.
Okay, this isn't rocket science.
Yeah, it's going to block the outlet.
Yeah.
It's going to-
And some of it's going to come
Yeah.
back.
Yeah.
We like that, though.
Yeah.
That's the MGB. In other words, we like the MGB to punish our patients if they go astray. In other words, they're walking down a path and there are cobras on either side.
Yeah.
We would like them to stay in the middle. Okay? When they say that I'm going to sit down and eat 2 or 3 plates of food, MGB is coming down. Remember
Yeah.
the wicked, strong, nasty grandmother?
Yeah.
She's going to come downstairs and said, now, how many pieces of chicken did you have? And she will punish you. So you will have the worst experience of your life. Most well-done MGBs, the patients will say, how much do you eat at night? And you say, imagine a whole plate. Would you eat a whole plate of food, or half a plate, or a quarter of a plate? If they eat more than a quarter of a plate, we will come to their house and ruin their day.
Yeah, that's what we see. So looking at the data from all the big series published throughout the world, the incidence of reflux after MGB is 1 to 2% in the best hands. I'm talking about the big series like Mario Mazzella, your series, my series, and then we have other friends around. So in 98% of the patients, maybe 99%, actually it helps settle the reflux. And like you said, for those who have done the MGB very correctly, but still you see reflux in your patient, then we'll need to look into either the diet of the patient, or you need to look inside whether there is some ulcer coming up or some other trouble. What do you have to say about this management?
Well, I would say that the very first thing that I see is a lot of surgeons teach this kind of generally approved post bariatric surgery diet, and it's lots of protein powders and artificial sweeteners and junk food and dairy and stuff like that, and that research shows that stuff causes reflux.
Yeah.
So one of the things is, the very first thing is really dirt simple, and that's eat a healthy diet. And so I like to refer to the new guidelines from the American Heart Association, and the very first thing is basically, as we've said already in a couple of videos, is fresh fruits, vegetables, whole grains, beans, high fiber foods like that, and avoid salt, sugar, and fat, and avoid basically meat, dairy, and eggs. Doesn't mean you can't have a little bit once in a while, but when you eat those high salt, high fat, high sugar foods, or meat, dairy, and eggs, you're more likely to get reflux.
So this was about MGB and the reflux.
Yes.
Thank you very much.